Okay, let's get started. Keep this nice and short today. Good afternoon. Happy Monday. Thank you so much for joining us. My name is Felicia Sprague. I am a dental regional manager in Toronto.
Hi, everybody. I am Dr. Aisling Whitaker. I am a dentist and clinic owner in Toronto. And with Felicia, we are the co-founders of Dental Hive. So, um, every so often, one Monday a month, we get together and we talk about various different things to help your clinic run smoother. This will be a 30-minute session, so please grab a coffee or your lunch, or depending on what time zone you're in. And we will be recording this webinar and it'll be posted on YouTube. So, hello to our YouTube followers. We know that that's where most of you will be watching. The resources that we will share today will also be posted available for free inside the Dental Hive app. So if you don't grab them from the webinar, you can grab them inside the app. Today, we're going to be discussing new employee onboarding and guiding you through the process that we use at our clinics here in Toronto for onboarding new team members and getting the most out of those first few months together.
Yeah, it's so important to just kind of streamline your onboarding process so you're not really missing anything in that first 3 months. So, this is you've done the working interview, you've done the reference check, you've made the offer and they've accepted. So now you're kind of like, oh, now what? Now it's time to really start an onboarding process. So I'm going to walk you through just a welcome email that we send to new employees. It'll just kind of give you an example of something that you can implement in your practices. All right, can everyone see that?
Yes, ma'am.
Perfect. Okay, so this is just an example of something that we send to new employees. So we just let them know, we're really excited that they've accepted, the role at our office because we are, the interviewing process is so tough and it's really exhausting. So when you finally find the right member for your team, it's really exciting and you want to kind of share that excitement with them and just let them know that you're really excited to watch them grow with your office. Let them just confirm the schedule. So, if they're a hygienist, they might have certain days of the week that you're just confirming with them their days and their hours. If they're maybe admin or an assistant, you might be scheduling them 4 to 5 days a week within your opening hours. So just kind of confirming like this is what our plan is for you. We always let them know where we will be posting their schedule. So like we use an app called Connect Team, for example. So we'll post their schedule in there, usually about 2 to 6 weeks before the month. So way well in advance. We just let them know that. We also kind of give them our expectations. So like if they need a day off or they're taking vacation, our offices prefer to have about 8 weeks notice, just so that we can kind of do the schedule before. Although, we always have team members that need last minute days off, and we're really accommodating, and they're really great as well as finding other team members to fill in for them. Again, you're confirming their hourly rate to start. We always let them know how they're being paid. So direct deposit every 2 weeks. I like to attach a payroll onboarding form so I get all their information ahead of time so I can set this up, before the first payroll. It's already done. I'm not stressing about it. And then I also let them know after probationary period what other benefits we have, like a healthcare spending account, 3 paid sick days, what we do for recommended courses. And also, if they're clinical, we like to supply our clinical team with scrubs after probationary period as well. This is also a good opportunity to introduce them to any apps that you or your office use. So if you use WhatsApp or Signal for like team communications, just sending them an invite to download it or to join your chats. We have an onboarding, or sorry, not onboarding, online training platform that we use. So we'll send an invite for that as well. And then just anything else you can think of that maybe the whole team uses that will be beneficial to kind of let them know before that they start. We also request any certifications, vaccine confirmations, license renewals, everything be sent before they start as well. And then we'd like to send a new employee survey, which is kind of just their preferences, which Ashlyn will go over in a few minutes there, because we like to get to know them a bit before they start and maybe put together a little welcome package for their first day, which is really a nice thing to do for your employees. And just let them know you're here for them if they have any questions.
So Fel, go ahead and share the employee preferences. So like Felicia said, we decided over the years to kind of create a survey for our new employees. And if you haven't got one of these on file for all of your employees, we recommend that you do that also. It's just a chance to kind of get to know them, how they learn, and what their preferences are. You know, as the office manager or the dentist, the clinic owner, we have all trained a lot of people over the years, and what you are quick to realize is that different people learn in different ways. Different people like to get feedback in different ways, and knowing that and selectively onboarding people in the way that works for them can help you have a much smoother process. So, Felicia, if you could share that. Oh, you have? Okay, perfect.
Yeah.
So this is our one-page employee preferences survey. And if you could share that in the chat as well, Phil, and then they will have
Yeah,
access.
absolutely.
So this is available inside the Dental Hive app too. And obviously you can use ours, or you're welcome to modify this for your clinic. So we understand that each individual is different, and so their preferences may be a little bit different. So we like to find out from them, what is their professional love language? What way do they like to be appreciated? And it is pretty interesting. Like if you go to lectures and things like that, you'll hear a lot about financial reward. But actually, what we have discovered with our team, a lot of the time it is education being invested in from that perspective, being able to continue their professional development, and also words of affirmation. So it's very important to kind of figure out, this is an important one for employee retention, is figuring out how to praise your staff members and how they actually accept that praise. What type of learner are they? So is this a video training type of a person, or is this someone who needs shadowing or a lot of hands-on workshopping to get to know their role? What way do they like to receive feedback? Some people are great at receiving feedback in person. Some people are not, and they take it personally if you do it in person. So figuring out what way they like to receive feedback, because if they're coming through our office, they're going to be getting a lot of feedback in those first 3 months, or even in the first year as we onboard them and train them into the role. How do they prefer to be recognized? How would they describe their communication style? Felicia, your mouse is going bananas.
Oh, sorry.
Um, Are they introvert or extrovert? Other than training, what can the clinic do to help them transition into their new position? What is their ideal type of team bonding events? This is a great way to pull up ideas for what you're planning over the year for team bonding and team appreciation events. And you'll see a real variety of suggestions. So it's great. And then some things that bring them joy. So, what is their favorite treat? These are kind of nice things to find out about for, if Hygienist Appreciation Week is coming up, or their birthday, or a work anniversary. So, what is their Starbucks drink order? Are they a sweet or savory kind of a person? Do they have any allergies? Um, how do they like to spend their free time, their favorite kind of products. We ask for their shoe and shirt size in case we're getting things for the clinic. Let's say we're getting t-shirts made and everything like that, that we can just look back and have all of these. So we get this employee preferences survey done either before or within that first week. And we have these on file for all staff members. And we update this from time to time. So then we'll send it out to all team members and just make sure that we have that we know what everybody's about. And it's been a really nice way, especially, Felicia's going to be talking about in our September meeting, but ways to encourage employee retention and ways to really give back to the team. It doesn't have to be financial, but just little ways of saying thanks. And for the purpose of today's, like really learning how they learn is really important. And it's really helped us streamline how we onboard each team member. Okay, so we are also going to go through with you our onboarding checklist. So over the years, we've created essentially a plan for the first intensive 3 weeks of a new employee at our office. Um, the probationary period in Ontario is 3 months. And in the past, we would kind of get to that 3 month mark and be like, oh no, we haven't actually really evaluated their skills or their knowledge in a certain area. So, what we've done is we've created a 3 week onboarding checklist. And after 3 weeks, we look at it again. So, we kind of have the first 6 weeks laid out. And if you hop over into the chat or onto the Dental Hive resources, you'll see the new employee onboarding. So the first page, pretty boring. It's just like their onboarding checklist. So their name, their email, the emergency contact, and so on. And then we check off when were the dates that they did specific training so that we know when they need to get updated in those. So if it's like an annual thing or whether or not it is due. Val, if you want to just share your PDF rather than your screen, unless you plan on not getting any messages in the background. Um, and then we look at have we gone through various different protocols with them? So the communications protocols and things like that that we have for the office. Have we reviewed with them clothing standards? I know it's a funny thing, but over the years we've definitely had a number of circumstances where we had to go over hygiene and clothing standards for certain roles. So have we kind of reviewed those expectations up front? And then just, the basics. We've given them their logins and that type of a thing.
We also have team standards and expectations. We think that this is just really important to kind of share how best our clinic runs and kind of give new employees that information ahead of time. So, what we expect in terms of punctuality, arriving early for work, so how early, and then if we're doing a huddle, which is usually with our clinical staff, like when we're going to be doing that, just attendance, dependability, communication, like if you're unable to make a shift, like when should you be messaging, cell phone use, no, permitting cell phone use. Some offices might, some offices might not. So it's good to just kind of put that in there. You can obviously customize this to your clinic. Training and feedback, just kind of giving them the expectations that this first 3 months, we're doing a lot of training and we're giving a lot of feedback. It's a whole new role. It's a whole new office for these employees. So just kind of showing them our expectations for this role and job is really important to kind of constantly be training during this first little bit. Team involvement, we think office culture is incredibly important. So just kind of letting them know that like we do, X amount of team activities or culture events per year. And we do expect attendance for at least 50% of them. It's a good way to kind of see your team members outside the clinic and bond with them. That has nothing to do with work. Vacation, just again, our expectations for how the notice we need for vacation time. And then professionalism, just how, we treat each other, showing commitment to our responsibilities, just our expectations for how our office runs.
So for all employees, we go through the week one all. So let's imagine they come in on day one. We want to have a plan for that day. If they are a clinical team member and they're going to have to jump right in, we like to set aside at least an hour blocked off. So we don't like somebody's first day to be on a day where no manager is in the office, let's say. We want to really have a plan for that, unless it doesn't work out, someone's on vacation, so then we might get somebody in for half a day before their first shift, obviously paid. So that first day, we're going to do a full clinic walkthrough. We're going to show them where everything is. We're going to describe the zones and where the medical emergency type of things are. Um, we're going to go through the management structure of the clinic. Every clinic is going to be different, and in our clinic, we have multiple clinics, so people will report to different people for different things. So if that's the case, it's very important to know who should I talk to about X, Y, and Z. Like who do I um, talk to about scheduling? Who do I talk to about payroll issues and so on? So we talk through the management structure so that they are familiar with who is who and who is in charge of what. We talk about our clinic core values and standards. We do have this team standards and expectations that we get them to sign off on, but we also talk about core values as it refers to our patient standards and our experience for the patient in the office, and also our experience for each team member within the team. Of course, we go through their duties and we'll go through the fact that we have this onboarding. We'll kind of give them a sense of how their duties will layer up over time. So we don't want to completely throw somebody in the deep end from day one. Going through the medical emergency kit and rules and safety protocols. And then for everybody, we will do a hand washing demo and assessment. I know it sounds so dental schoolish, but it is surprising how quickly we drop some of our very basic skills. So we'll go through hand washing, clinical zones and what's expected, what you can and cannot do, like in terms of where you wear your gloves. We don't want them outside of the op, we want them dumped, like how we transport our trays, things like that. So we're very nitty-gritty on those things. And then some software basics, logins, overview of how your software works, if it's something different from a different office, overview of how our schedule is structured so that they know how to book people back, and then the basics of creating appointments, writing notes, all of the basic things that they will need for that first week of work to just get in and see patients and not feel like they're falling behind. We talk about teamwork and what that means for our clinic, and that will be different from one clinic to another. We talk about our downtime tasks list, of which we have shared in Dental Hive. So we have for each role how to prioritize their time if they do get a cancellation. In our clinic, we do pay for cancellations, so people are still working in the clinic during that time, and so they have a list of things that they can get done during that time. Cell phone use, as Felicia explained, and we do this written and we do this verbally. We just want to make sure that we're all on the same page in terms of cell phone usage throughout the clinic, how garbage works, how laundry in our clinic works in terms of gowns. And then if there's anything else specific to that person, we'll write it in, we'll date and initial it. And as I mentioned, we're going to return back to this at the 6-week mark. So this is our week 1 for all team members, and Felicia's going to go through our reception list.
Yeah, so we have week 1, 2, and 3 for reception. Again, you customize these to how your clinic runs, but the week 1, we basically want to set our receptions up to kind of know all of the basics. If, for some reason our second receptionist calls in sick and the manager's sick and you're the only person there, you know how to check a patient out, how to create a new patient, what the verbiage is for phones, emails, text messages, how to add details to a patient file or like edit them. We send all of our forms electronically. So how to send forms, how to transfer those forms that are filled out into the files, how our release of records works, canceling appointments, rescheduling appointments, what's your cancellation policy, making notes. So making notes in the schedule or making notes in the ledger, kind of like how our ledger works. So like how do we know if we need to collect money or how do you send a claim? So we're going to go through basically all of that information, kind of seeing a patient from the minute they call to the minute they come in and then they leave afterwards. So we're going to go through all of that, usually in the first week. Also breakdowns. I mean, it's quite possible that if they've been reception before, they've done that at a previous office, but just where we putting those breakdowns in our files, and just how we're dealing with different types of phone calls. Week 2, we're looking at setting codes if you have to, for some reason, put codes into a system, or if a patient coming in to get like whitening or something, you have to add in a fee into the ledger. Just how the clinic fee is structured. estimates, so how we're sending basic estimates electronically, how we're mailing major estimates, what we're mailing it with, how we follow up on estimates, like what's our protocol for that, referring patients out, what we do when we get reports back in, lab work. We always audit a week out and then the next day just to make sure we have all the labs back, we have breakdowns done, what are the patients coming in for. We want to know all this information, make sure any major estimates are back. And then we have a bunch of lists that, we're constantly working on, like hygiene retention, our to reschedule list, pending treatment. So we want to make sure we're kind of introducing them to that and the timeline that we have for those things. Medical history forms, any other screening form, and then like an end of the day checklist. So everything that is done at the end of the day and then them leaving. And then our third week, we're introducing even more. So how are we archiving patients, what to do if a patient declines treatment? We're looking at the frequency of hygiene exams, x-rays, how we expect conflict resolution with our patients to go, communication with the dentist or managers on day off. That's something, we don't like to do. Like outside office hours, we're very much no communication, or at least we try to be unless it's fun. Ordering supplies. So how do you get something ordered for the office? Entering direct deposits if that's part of their job, entering checks, how we set up payment plans, and then just daily, monthly tasks and specialist knowledge. And then obviously anything else, that might be clinic specific to your office. Just anything else that, as they come up, what are we teaching them? Again, we're dating, initialing, and then doing another review at 6 weeks just to make sure that this is down pat.
And it may seem super itemized, but what we have done this over the years because you take things for granted, actually, even
Mhm.
if somebody comes in with experience. And every office is a little bit different. So, really getting the systems nailed down makes for a much smoother day-to-day clinical life. So, it is absolutely worth it. And you're talking about these things over a week, so you can kind of do a number of them in a day. And setting aside that time to do it is very, very important. So I'm going to review the first few weeks with the assistant and hygienist. Some of the stuff overlaps with each other. So we'll start with the assistants and we'll take it from there. So we're going to start in the first week with really like the basics. And so a lot of this stuff will be very familiar to everybody, even if they're a new grad. But we just want to make sure that we're setting the tone for how it is done in our clinics. So we'll set up those cross-infection standards. We will go over our reprocessing protocols. We have actually videoed our full reprocessing step by step. So we'll watch a video first, then we'll do it in person, and then we'll shadow them doing it. We'll go over tray setup. So in our steri room, we set up the trays for all of the other providers. The providers don't set up their own trays. So we have images of what each tray looks like, and we'll go through that with them and make sure that they're very familiar with where everything is there. We'll go over some basic housekeeping that they do outside of like our cleaning service coming in. Sharps disposal, operatory standards. What I mean by that is I like the room to be kept pristine, in between each patient and have as little out as possible. And so setting that expectation of this is how it's done in our clinic is important. Even down to how I want the clinic to be left once the blinds are up at the end of the day and people are walking by, like what do those rooms look like? We'll go over what the morning setup looks like, the room turnover, the evening tear down, and we'll detail what that is in each operatory and what the expectations are. How to clean the chair if you have specific leather, how to clean the light so that it doesn't crack and get damaged. And then we'll go through some of the more clinical things. So taking vitals on each patient and actually demonstrating it and getting them to do it, show us how they do it with the various blood pressure monitors and things like that we have. Reviewing radiographs, so how the dentist likes to have those up in the room or how the hygienist can do that. Reviewing 3D scans if you take them, what that looks like, how to look at the patient's forms and consents, how to review notes and write notes and set codes, booking the next appointment back, and also around what the expectation is, who is doing that and when. So is the hygienist setting their own codes in our offices? Yes, and then they're letting the receptionist know that they're set. What does that workflow look like in your clinic? How often are we doing those appointments, depending on the perio status of the patient, and how often are we doing exams for patients too? And then they also have an end of day checklist to make sure that their notes are locked, notes are written and locked, that all the codes were set, that the right provider was set, and so on. We'll go through patient soft skills, which we believe are just as important as our clinical skills. So, really, what that patient experience looks like in terms of verbiage and patient education, and getting that balance right of being an educator, but also making that connection with the patient. And then in that first week for the assistants, they're shadowing as opposed to chairside. Sometimes this depends on the skill level of the assistant. If they're super ready, maybe by the end of the first week, they'll already be jumping in. But in the initial first few days anyway, they're going to shadow a restorative, they're going to shadow a crown, they're going to shadow a merge, they're going to shadow a child prophy, and they're going to know exactly what our more lead assistant does in those situations. So just like with the reception team, we also have daily, weekly, and monthly tasks or tests for the assisting team. So, those can be the tests in steri, or they can be the water tests, or they can be calibration tests. So we just go through with them how we take those and where we log them. And then we'll also go over some of the most common equipment issues. And by now we've recorded those. So our lead assistant has recorded her problem solving skills, various different things of what happens with the chair. And because these can be, freak out moments on these assistants if it's their first day without a lead assistant there. So then they have a kind of a little video library of very common issues. We'll go through how to review the day sheet for the assistant. We'll also go through a detailed operatory tour, the layout, where everything is kept, where everything is put back, some chairside cross infections. Now we're kind of getting into their chairside training, room turnover, suction preferences for the dentists. Sounds crazy, but every dentist has their own preferences when it comes to suction and air water. So we go through that in detail. Charting, how to do it, how to chart the probing, and then some skills related to photography, scanning, how we do stepwise for radiography, how we log our radiographs. And then they start to assist. So at this point, they've already shadowed the restorative, the crown, the emerge, the child, and now they are assisting for these. And now they're shadowing their next batch of appointments. So the new patient exam, night guard insert, and so on. We want to make sure that they shadow things where they have to use a lot of verbiage and they hear it over and over and over again before they're alone doing that. And so when they start to do it for real, there is somebody shadowing them. And then week 3, going through the last few areas of their duties. So some lab work, protocols and organization, how to send an estimate if the dentist wants to quickly do it in the room. Obviously, a lot of the time that will be go to the reception team, but for something really fast, we'll do it in operatory. And the patient asks, am I covered for that night guard? We can just check that electronically very quickly. How we refer out, what that looks like. The clinic fee structure. So, in Ontario, we follow the Ontario fee guide, but there are certain things that might fall outside of that if there are more specialty items that you do. How to prepare or give the patient the consent and how to go through it with them before the dentist comes in, how to go through post-op instructions for various appointments, and then they start to assist for those things that they had shadowed on before. And we believe really that new patient exam is almost the most critical one. It's sort of the one that we leave for last because that is the lasting impression that they have on the patient. And then we'll go through some of the other protocols that they may or may not have access or need to assist on right away, the whitening, sedation, ortho, laser, and so on. And a lot of our assistants are also cross-trained on breakdowns. So in the interest of time, I won't go through in detail the hygienist one because there's a lot of overlap here. With the hygienist, we'll also see what are they certified on and are we going to be getting them certified? So for us, that looks like laser, and then we'll also do a lot of ortho training and 3D 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 3D
Perfect. And yeah, like we said, you can really add and switch those around to however works best with your clinic flow. We also recommend around 6 weeks when you know you're doing a review with your new employee. You're also doing a check-in with your team. You want to see, how is the new employee getting along with the rest of the team? Is the personality fit right? Are there any issues or is there any kind of training that needs to be repeated?
And then when it comes up to your 3 month probation, if that's how it is in the area that you live in, you're fully prepared for whether or not you're going to continue with this employee or not. And it shouldn't just be a surprise within a few days prior to that 3 month mark. We do ask for feedback from our team about 2 weeks out, and we get that feedback, and then the managers get together to make that decision on holding on to that employee. And honestly, if you follow this type of a protocol where you have a week on week plan, it really gives you that opportunity to make sure that they're the right fit and that they're picking up what you're putting out there and that they're following the systems that you have at the office that you know can help you run smoothly. So thank you everybody for joining us today. We will be posting on YouTube so that you can watch the recording. The printouts are available inside Dental Hive app. And then our next meeting, we are taking a break for the summer and we will be meeting again on Monday, the 15th of September at 12 p.m. EST again. And tell us what we're going to be covering that day, Phil.
Yeah, we're going to talk about employee retention, some tips and tricks for keeping your employees in your office and having them grow with you long term.
Thank you so much, everybody. Have a great
Thank
day.
you.